What if the hospital came to your patient's home instead of the other way around? That sounds convenient, right? But for us nurses, it's not that simple. When care moves out of the hospital and into the living rooms, kitchens, and even bedrooms, our roles transforms completely. But here's the kicker: this shift isn't coming, it's already here. I've worked over 20 years in healthcare. I've seen patients tethered to IV poles and now healing on a sofa with their dog curled up beside them. And while the setting is cozy, the care demands not so much. In this video, we'll unpack what it really means when hospitals moves into homes, how it affects us as seasoned nurses, and the practical ways we can adapt without burning out. Imagine this: you show up to a patient's home for a complex wound care procedure. There's no sterile tray, no suction wall. The nurse's station, it's a dining table with flickering candles. I once had to manage an antibiotic regimen while the patient's toddler spilled juice under my feet. Let's just say infection control takes a new challenge. But across Denmark and beyond, more and more hospital-level treatments are moving into homes. Chemotherapy, dialysis, even post-surgical recovery. And nurses are expected to bring hospital standards into unpredictable spaces. But this isn't about chaos, it's about opportunity. Because we, as experienced nurses, brings something younger colleagues don't: clinical judgment, autonomy, and decades of intuition. Home-based care forces us to sharpen those skills. There's no team just a hall away. You are the IV specialist, the educator, the mental health counselor, and sometimes the plumber. Start building your own mobile care system. Many nurses now carry collapsible sterile fields, mini medication fridges, even backup Wi-Fi routers for documentations on the go. And at one of my last jobs, I gave patient instructions while their cat repeatedly jumped into my bag. I'm not saying I chatted with fur on my keyboard, but I'm also not saying I didn't. Here's the tip that changed the game for me. Don't treat homes like hospitals. Treat them like ecosystems with the patient at the center, not the protocol. The home might not have an intercom or a code button, but it does have trust. And in that trust lies your superpower. So when the hospital moves home, we don't just bring the care. We bring the calm, the clarity, and the courage that only seasoned nurses carry. And if this spoke to you, click right here to watch my video that YouTube knows you will like. So make sure that you check it out right there. And I look forward to seeing you right over there in another great video.